here. Welcome back. We want to invite you into our new series. So we're going to be breaking apart our physical health moments. We're going to be doing a chronic pain series. Chronic pain keeps so many people down, and it affects life, and it affects mood, and it affects the ability to go out and do things with people. So we want to start breaking down some components that affect chronic pain, and also some things that can just help you deal with your chronic pain. So today's series, we're going to be doing the pelvis. The pelvis, a commonly missed component in chronic pain. So we're having a visitor come in, and we hope you enjoy. She's never gotten treated for back pain, and you're going to go ahead and get to see what that looks like and how it affects her when her pelvis is affected and when her pelvis is treated. So don't forget to hit subscribe, join us, and continue to just learn and empower yourself to be healthy and live the best quality of life you can.
Hi, this is Dr. Dale Little from Physical Therapy and Balance Center. We're here for another physical health moment. With me is Annalise.
Yes.
And Annalise has had a history of about 5 years of lower back pain. And so today we're going to be looking at Annalise's back, and we're going to be examining her pelvis and her spine to see if we can find what might be going on for her. So could you just tell us a little bit what's going on?
Yes, I've had back pain for 5 years, and it's very painful in the mornings. It's hard to get out of bed. That's pretty much the pain that I experience. It's about a 5 right now.
Okay.
So
is the pain localized to your back?
My mid back and lower.
Okay, does any pain go down your legs?
I have a little bit of tension in my right leg.
Okay, but no tingling, numbness,
No.
anything like that? Any weakness?
No weakness.
Okay, all right. So we're going to be looking at your back and pelvis and just see what we find, okay?
Great, thank you.
Okay. So we have Annalise faced in a prone position, and we're going to be looking at her back and pelvis from this angle. And the first thing we're going to be doing is looking at her position of her sacrum. And I'm going to place my thumbs on either side of her sacrum, and I'm noticing immediately that the right thumb is deeper than the left. So that tells me that her sacrum is rotated to the left. If I push on the right side, we can see there's movement. Can you feel movement?
Yes.
Okay. If I push on the left side, what does that feel like?
Feels great.
Okay. Does one side seem to move easier
Yes,
than the other?
the right.
The right moves, and then the left side seems
More
a little
inclined.
stiffer.
Mm-hmm.
And then the right side up here, do you notice movement?
Yes, and there's
Okay.
slight pain too.
And slight pain. And then how about the left side?
Feels great.
Feels great. And to me, it's a little stiff here. This side moves.
Yes.
This side here
Yes.
doesn't move. But it feels good to have it pushed on, huh?
Oh, yes.
Okay, good. Looking at your lower back here, I'm going to push on the right side. Is that tender?
Yes.
It is? Okay, I'm going to push on the left side. And does that bother you?
Slightly.
Slightly.
Not as bad.
Okay. And then I'm going to look at your back right here. And over this way. You have movement both directions, but when I move you like that, how does that feel right there?
Feels great.
Okay. Okay, and then over this way. See how that moves? There's not much resistance.
Yes.
And then here, there's a little resistance to movement. That's what I'm feeling, okay? So you've got all the classic hallmarks of what's called the sacral torsion. And so what we're going to be doing is looking at other things that are being caused by this.
Okay.
And so when I treat the pelvis and the sacral torsion, what we're going to see is we're going to see other things change as well, okay? So one of the things oftentimes with the pelvic problems that people come in with is they'll come in with a leg length differential. So I'm going to look at your medial malleoli here and just see that they look pretty level to me. Okay. And I'm going to be looking at your hips and your knees and a little leg raise. Now notice right here, what I'm observing is how your leg is kind of angling inward, okay? And if I go on to the other side, let's see if I do a straight leg raise, what happens here. coming up. And notice there's a difference. Okay?
Yes.
It doesn't angle inward like the other side.
Right.
Okay. And I'm going to check that. That looks good. And I'm going to move that. Now, can you feel me move you?
Not really.
Not really. Can you watch my fingers move here?
Okay.
So I'm moving. This is your fibula.
Okay.
And I'm moving the fibular head right here, which is
Okay.
part of your knee. And I'm just moving that very easily.
Okay.
And there's lots of movement there.
Oh, okay.
And then right here in your ankle, there's lots of movement.
Yes.
Okay, and that's normal.
Normal.
A normal movement. We're going to come over here, we're going to compare sides. And we're going to bring this one up. And then we're basically looking at same or different.
Mm-hmm.
Okay? And what I'm noticing here as I move you, it doesn't move as freely as this side. Okay, it's a little stiffer. And I'm going to move this ankle. And, okay, so I want you to tell me what this side feels like compared to this side.
Oh yeah, it's much looser.
Much
here.
looser over this side.
Mhm.
Okay, and that's common as to what we
Okay.
find. Okay, I also find that this tends to feel looser
Yes.
in comparison to the other side. Go ahead and bend this knee. And so that's oftentimes what I find. Okay.
Mhm.
All right, I'm going to come up to your shoulders for a second. I'm going to push on this shoulder and notice how that feels.
Mhm.
Okay, and then I'm going to come around to the other side. And I want you to observe how that feels.
Wow. More loose.
Looser on the side, yeah. Okay. And can you roll towards me, please? Okay, we're just going to look at your shoulders here. So I'm just going to borrow this shoulder. I'm going to move this one down. Notice you touch the table. That's normal.
Okay.
And sometimes it's a little restricted, but
Yes.
that's pretty normal. Okay. Now let's turn to the other side. And we're going to compare sides. Can you relax there? That's nice. And then let's compare this side. And tell me what that feels like. Yeah. What does that feel like to you? Tense. And you can observe that her hand does not touch the table. Whereas with the left side, we got the hand to touch the table easily.
Wow.
And that feels like, okay, don't keep it there and please don't push it any harder, right? Because it's pretty under a lot of tension.
Yes.
Okay, good. Okay, I'm going to show you one or two more things and then we're going to treat your pelvis and then we're going to look and see if there's a difference. So we're going to play same or different, okay?
Okay.
All right. What we're going to look at first is your first rib. So here's your clavicles. And what a lot of people don't realize is your ribs come way up to here and your first rib is right there. The first rib attaches to your first thoracic vertebra and attaches on the front to the sternum. What we're going to be doing is I'm just going to be pushing downward on your rib and notice that that seems to move pretty freely and there's not much restriction to my movement and we're just kind of saying, okay, yeah, that I can feel that. Now we're going to compare sides and you tell me same or different.
Different.
What do you feel different?
This is more, the left is more loose.
The left is looser, the right feels tight, right?
Yes.
Okay. And then next thing we're going to look is your neck range of motion. And we're going to specifically look at your first cervical vertebra on the second cervical vertebra. And we're going to be looking at rotation of your head, okay? First, I'm going to look at side bend. And we're going to side bend you to the right. That goes really nicely. And we're going to gently side bend you to the left. And what does that feel like over there? Is that about the same? Or?
About the same.
Okay. And we're going to gently turn you to the left. How do you feel?
Oh, great.
Okay. And that's normal motion. That's what we expect. So I side bend you, and I'm just trying to get pure rotation of your upper cervical spine. Now I'm going to side bend you to the left. And I'm going to rotate you to the right. And tell me if that feels different than the other side.
More tense.
More tense, yeah. And it's tense. It doesn't go as far.
Yes.
Okay. Yeah, you can totally see the difference, right?
Yes.
Okay. Because when I come over this way, I'm not trying to do anything that's rough, aggressive, or anything. We're just gently seeing where the movement stops. It stops right there. Okay. So the next thing I'm going to do is I'm just going to treat you. I'm only going to treat your pelvis.
Okay.
And we're just going to compare before and after of how your body feels, how you feel, as we reassess what's going on, okay?
Okay.
So this is the first thing I typically will treat when I have a patient come into the office. They come in with all sorts of complaints. They can come in with neck pain. They can come in with headaches. They can come in with back pain like you did. They can also come in with hip pain, knee pain, ankle pain, just all sorts of problems. And a big part of what I'm looking at is how well is the body balanced. Okay, so our objective is to balance out your body, all right? So I look at the pelvis as the central hub for your body, okay? So this is a pretty simple treatment. I've combined several treatments together and basically come up with this one concept, okay? So what we're going to do is have you push your knees out, and now push your knees apart for me. Go and push out. And now I want you to take a nice deep breath in and exhale and squeeze your knees together. Good. Okay. Take a breath in and then push your knees apart as you exhale. Exhale.
Your pelvis is not one solid bone, but there are actually 3 distinct joints.
And last time, breath in, squeeze and blow out. Excellent. Okay, now I'm going to bar your leg here, and I'm going to bring your leg out to the side, and you kind of feel tension increase there.
Okay.
And this is pretty gentle, right?
Yes.
Okay. And now I want you to take another breath in, and as you exhale, I want you to pull your leg inward. Pull in. There you go. And relax. And bring your leg out. Take a deep breath in, and as you pull in, breathe out. Excellent. Now relax there. Okay. So we came up to this side, and we're going to compare it to before and after.
Mm-hmm.
So this side moved great,
Yes.
and your left ankle moved very, very well. Okay.
Mm-hmm.
Now we're going to compare sides. Okay. So we're going to see if this is the same or different.
Different.
Yeah. I can see the movement. Can you feel the movement?
Yes.
Now we're going to look at your ankle. Are you ready?
Mm-hmm. Yeah, different.
Different. Lots of movement there, right?
Mm-hmm.
That's what we always see with this technique, okay?
Okay.
Then as I bring your leg up again, notice it's not angling inward like it was.
Wow.
And the reason why it's doing that is because your pelvis was kind of doing this.
Yes.
It was rotated and then pulled inward on the right. So it's pulled up and out on the left and inward and down on the right. And that's taking your hip, your femur right here,
Mm-hmm.
and it's basically turning it inward and it's following your pelvis.
Yes.
And so that's why that's going on, okay?
Okay.
And so we're going to come up to your shoulder now, and we're going to compare it before and after. So I'm just going to push on there. How does that feel?
Feels great.
Notice before that it was a little stiff?
Right.
Yeah. Now can you roll on your side towards me? Okay, so this is the same or different, okay? So relax, there you go, and how's that?
Wow. Different.
You're touching.
Touching.
Yeah. So that's before you were right there, and
Yes.
it was a lot of tension. We
Yes.
talked about that.
Mm-hmm.
And now, relax there, and we can go all the way down.
Wow.
We're going to side bend you again to the right, and this was the good direction.
Mm-hmm.
This was left, and that was lots of motion, okay? Now we're going to bring you over to the left, and we're going to turn.
Wow. Big difference.
Huge difference, right? Because before you were about there,
Yes.
and if I pushed any further, you would not have been happy with me. It would have been very uncomfortable.
Mm-hmm.
It felt tight. It was an uncomfortable position. Now you're way here, okay? And the last thing we looked at was your first rib. We talked about how the left side felt nice and mobile, and the right side was a little stiff. And tell me how this feels.
Feels great.
Does that feel any different than it did before?
Yes.
More mobile, less mobile?
More
Mobile.
Mm-hmm.
Okay, good. Excellent. So what we were seeing today was what's called the sacral torsion. So the sacrum is this bone right here.
Mm-hmm.
It's between your two pelvic bones, okay? And the sacrum can get turned or twisted in a number of directions, left, right, up, down.
Mm-hmm.
And it can cause the other bones to actually be out of sort of alignment or out of balance. So the pelvic bones can be turned and twisted and rotated is what we saw. And here's the right side, and this is the acetabulum. That's where your hip socket is, okay? So what happens is the pelvis is twisted and turned inward and stuck there, and your hip starts moving in this angle. That's what we saw when you were lying on the table. When we balance out your pelvis, which actually was very simple, then we can get the femur to start moving the way it's supposed to, which takes stress off of your knees and your hips and your back.
Ground reaction forces should hit your right and left side of the body the same. If you have a sacral torsion or your pelvis is out, it's going to hit one side more than the other, creating compression and pain.
In the back, what we're seeing is the sacrum is turned and side bent, so it's rotated and side bent.
Wow.
And so that's going to take these bones and joints and it's going to make them tight. So by balancing this out and getting that more neutral, you notice the difference from what you felt. But that's going to follow all the way up.
Wow.
That's why we saw problems down here and we treated down here, but we saw improvements up in here.
Right.
And just think of your body as being a continuous chain, and everything, one thing does affect the other, okay? And how do you feel?
I feel amazing.
Okay.
Big difference.
Oh,
Thank
wonderful.
you.
Thank you very much. This is Dr. Dale Little with Physical Therapy and Balance Centers, another physical health moment. Thank you very much. It's been wonderful.
Thank you for having me.
Hi, it's Dr. Lisa. I'm just checking in with Annalise to see how she's feeling after she got work done today. So how are you feeling?
I feel amazing. I'm amazed that he didn't have to crack me. I feel no pain. I feel like more mobile. I feel more loose. My neck feels much looser, and I finally just bend over without any pain. I'm amazed.
Yeah, so this is your first experience. You've never had treatment for your low back before?
Never.
Okay. And so you feel like you said you can squat down, you can bend.
Yes.
How's that feeling?
Feels really good.
Great. How's your walking feel?
My walking feels much better. I feel more like in alignment. My body feels more good.
Great. All right, well, thank you so much for your time today. We really appreciate it.